Harvard Community Health Plan and Pilgrim Health Care, a merger for the future. Here to talk with Marty Sender about the merger are Manuel Ferris, President and CEO of Harvard, and Alan Greenberg, CEO of Pilgrim. Harvard Community Health Plan is a successful HMO, so is Pilgrim Health Care. Why merge them together? Why are you doing this?
To be better, so that each of us will be stronger as a result of the merger. You know, when we look at the needs of the marketplace, which is really what drove us to have our discussions about the possibility of doing this, if we look at what the marketplace needs, it is very clear that combining these two organizations will do that better than either one of us could have done alone. So the result of that is that it isn't 1 + 1 = 2, it's 1 + 1 = 3, because we will be stronger together than we would have been apart, as far as I'm concerned.
And, you know, we've been obviously very successful organizations. The past 10 years, we've demonstrated that clearly. It's been competitive the last 10 years. As Manny and I look towards the future, over the next 10 years, it is going to be very competitive out there. And we believe that together, we're going to be in a much better situation by combining the organizations to maintain our success and improve upon it than just saying we've been successful in the past individually, well, why don't we just continue along that track? The future is going to be different challenges for us. Together, we're going to be in a better situation to meet those challenges.
Each of your organizations is different. They're organized differently, managed differently. You have different corporate cultures. How are you going to make these two different entities fit together into one?
Well, you know, I keep hearing about how different Pilgrim is from Harvard Community Health Plan, and they're not that different organizations. We're in the same business. We manage medical care. We improve the quality of our patients' care. We try to hold down the cost of care. We operate in very, very similar fashions. There are differences, obviously, in the delivery systems, the health centers division, the Pilgrim IPA, independent doctors, and those delivery systems will operate in parallel within the new organizational structure.
Yeah, actually, there are much more similarities than there are differences, in fact, because the organizations were both founded by physicians, are very physician-driven, have an enormous commitment to quality, have an enormous commitment to member satisfaction, so that each of our organizations use a whole variety of techniques to make sure that we're meeting the needs of our members. And when we compare the things that we're doing, they're much more compatible, frankly, than I think either one of us thought before we began our discussions.
How will the merger play itself out initially? What can people expect over the next few months?
I think Alan and I have been in agreement from day one on this. The thing that we need to do immediately in this new merged entity is to identify those things that we need to be for our customers, because it's one thing to be able to meet our internal needs, our delivery systems, and all the other things we have to do. But the real priority is to find out what it is our customers expect from us and to organize ourselves accordingly. And so those very few areas that we're talking about, and we're talking about marketing and sales and one or two others only, we're going to merge instantly. And that is what our customer expects us to provide. So that's what's going to be merged immediately. In the meantime, the two organizations are very successful organizations. For a period of time will continue to be separate businesses, because we are to the public Pilgrim on the one hand and Harvard Community on the other hand, until we merge all these entities. But there's no question about what our priority is, and that is to meet our customer needs as quickly as we can.
And one way I've been explaining it is that the members out there that have a Harvard Community Health Plan ID card in their wallet, they'll still have that Harvard Health Plan ID card, and the same with Pilgrim members. And that will go on for a number of months, probably up to a year, until we actually put the products together. But in addition to some of those areas that are instantly going to be merged, as you said, like sales and marketing, what will also happen in the first 2 or 3 months will be we'll convene a group of employees, probably full-time, in a product group to take a look at how to put together the organizations, how to align the products into a seamless offering to our employers. And that will be very exciting but very challenging over the first few months of the merger.
How will this merger affect your employees?
Well, one thing I think they have to understand is that most positions won't change. Most people will be doing the same things on day one of the merger and year one after the merger is consummated and year two. There obviously will be jobs that will change in some fashion, but for the most part, the things that we're doing will continue along the same path that we're doing them right now. What I think we'll need to be thinking about is one company. How can we benchmark our best practices? What is Pilgrim doing well that Harvard needs to look at? What is Harvard doing well that Pilgrim needs to look at? So together, as we merge into a new entity, as a unified organization, we're coming out of that with the strength of the combined organizations.
And you know, we'll be integrating other things as they make sense to us as we go along. But you know, for the foreseeable future, I mean, we still have contracts with a whole bunch of employers who expect us to deliver services. So does Pilgrim. We can't change that. But this team that Alan was talking about are going to work very diligently to figure out how can we blend these products so that when we next go out to our customers a year from now, we will be one company and we will be united. And between now and then, my suspicion is that we'll find some other things that are better served for the new company to have merged entities. But the vast majority of the employees are going to have the same function tomorrow as they had yesterday. And if they're in the delivery system, they're still the same. As Alan was saying earlier, if we're processing 3 million claims in one company and 3 million in another, we're now processing still 6 million claims. So that isn't going to go away. And the intent of the merger, and I think this is very important for our employees to understand, Marty, the intent of the merger is to bring two strong companies together to be a stronger force in the marketplace, to be able to meet the needs of large customers and employers. It is not designed to cut a whole bunch of expenses. That's not the intent. The intent is to bring this organization together and grow it and fuel much further growth than either one of us could have had separately. So there'll be more jobs created, not less jobs created.
And one thing, Manny, there's sort of a guiding principle around the first few months and the first year, which is take it slow and be very careful what we do. We know the whole world is watching. Our employees are watching, obviously, but so are our customers watching. And we want to do it right the first time. And I know that's an expression that's sort of worn off on many people, but the reality is that it's much better and much wiser for us to take things slow, to make sure we're ready for going out into the marketplace with a new product, that we are really, truly ready, and not to jump the gun. Because as Manny said, we're two strong organizations. We're not going anywhere independently. We're going to keep our respective businesses going very strong in the interim. And when we're ready to get together and we're ready to show a unified product offering, we'll be there, and we'll be there flawlessly.
And in the future, growth strategy?
Well, clearly, one reason we're getting together is because we think we can be much better as a unified organization, and we both have growth strategies. During the first year, we're going to be very much focused on putting the companies together, the resources, the products. But when you look at a longer-term horizon, what's the organization going to achieve over the next 2 to 3 to 5 years? We're looking at tremendous growth opportunities, and I think that's the very positive message that all the employees should understand. For all of us is we're having the best jobs, the best opportunities if the company is the most successful. And we do have a growth strategy. We're looking at growing our service area. We're looking at product diversity. We're looking at bringing many more customers, many more members to serve than we have right now.
Well, and the other part of it, Marty, that I think is important for all of our employees to understand is that after this entity is merged in this marketplace, in New England, we can't be replicated. No one is going to be able to come in and create another million-member organization that has staff model, that has group model, that has IPA model, that provides the enormity of choice for our members. Nobody's going to come in here and be able to do that. So we're going to be able to deliver services to our customers better, quicker than any other entity around. It's a very competitive world out there. So we're convinced that together we're going to be a far stronger entity than we would be continuing to compete or not bringing our resources together in the manner that we're talking about here.
What message about this merger do you want your employees to know?
Well, they brought us here. I mean, the reason these two companies are successful is because of the employees that we're talking to today. They are the ones that made both these organizations what they are. They are the ones that are going to make the new organization what it is going to be. It is their strength, their capacity, their dedication that has allowed us to become the good, strong organizations we have been. So we want them to continue to do their good work. We want them to greet this with enthusiasm because of the enormity of the opportunities that are going to exist for each of them as we grow in the future. So first of all, I think it's appropriate to thank them for having dedicated themselves the way they have and the quality way that they've done it. And we're grateful for that.
Both organizations deeply value and they respect their employees. And it's not just we recognize they got us here, and we deeply value them. And bringing us together with those similar cultures and similar mindsets, I think is going to be easy to do.
Before you sign the documents that will actually make this merger happen, what final thoughts do you have?
The final thoughts are that this is the most exciting thing I can imagine, and certainly my career, that the opportunity here for all of Pilgrim's employees and all of Harvard's employees to create this new entity, to make it most successful, to improve actually the quality of life, the quality of patient care within the communities that we serve, I think is a great opportunity, and I think it's going to be very challenging, and it's very exciting for us.
You know, I think we have an opportunity to create something that cannot have an equal, Marty, and not very often do you have that opportunity in your lifetime. And that opportunity is going to be shared with every one of the employees of both organizations. So the challenge for us is to make it right, as Alan indicated before, but the real opportunity is for every employee to make a contribution towards this, to improving the quality of care that we deliver at a reduced cost, and bringing these management teams together for the opportunity of the synergy that takes place when you get this amount of talent. I tell you, I walk into our management meetings, and the amount of talent that exists in that room together is incredible. There is no equal, and that's the opportunity that awaits us, and I'm looking forward to it with great joy.
And you know, there's a very exciting piece of all this that we haven't talked about that much as we've been negotiating and meeting with each other. And that exciting piece is that it's up to us, within the confines of our own walls, within the own organization, our employees, to make us the most successful organization out there. There's no other outside factors that are going to sort of mess us up and get us off track here. We can do it ourselves. We can create the most success, and that's a really good feeling that we're going to, and we have so much confidence. Manny and I, we look at our respective management teams and all of our employees, and we say, this is it. We've got the best dedicated workforce possible, and we're going to create the best and most successful organization out there.
You have your pens with you? You ready to sign?
Sure.
this?
Yeah, well, let's go sign it.
Let's go do it.
We're ready for this?
We're ready?
Let's
do it.
so. Let's
All
sign
right. The intent is to bring this organization together and grow it and fuel much further growth than either one of us could have had separately.
Together, as we merge into a new entity, as a unified organization, we're coming out of that with the strength of the combined organizations.
Done.
Congratulations.
Congratulations.